Welcome back, Lindsay Friedman, the founder of LTCareNav. Lindsay, always great to see you. You brought a couple of your partners from LTCareNav with you, Kim and Casey. Welcome, ladies. How are you?
Thank you. Hello, how are you?
Great, thank you.
Uh, Kim, I'm going to start with you. If you just want to do a brief introduction, and I know you're with CarePatrol and your location for our viewers and listeners, and then Casey will go to you and have you do the same.
Hi, thank you. My name is Kim Little with Care Patrol of Hampton Roads. We are in the eastern area of Virginia.
Welcome. And Casey.
Hi, my name is Casey Adams. I am the owner of Care Patrol of Fayetteville in North Carolina.
Welcome, guys. Lindsay, LT CareNav does a great job of, partnering with Care Patrol and several other organizations. And, Casey and Kim each have their own Care Patrol location. I wanted to start, though, by asking you ladies, a lot of families assume that because they're the oldest child or listed as the next of kin, that they automatically have the authority to make medical or financial decisions. Can you explain why that's one of the biggest misconceptions you see, and what documents every family should have in place?
Well, since my oldest child is on the podcast here with me, we are actually mother, daughter, and business partners. I'll take that one. So hopefully she'll be prepared, or I will prepare. I will prepare so she will be able to handle my affairs appropriately. But a lot of times people do think that they think that the oldest child is going to kick in and either let the family move in with them and or has this privilege of access to information or decision making. And we're not attorneys at all, and we would always refer you to an elder law attorney. But there are a couple things that make the transition a lot faster. Durable power of attorney would allow you access to like banking information, insurance information, that kind of thing. You always want to have a medical or healthcare directive so that people know what your intentions are should you be in a crisis or a tragic situation where a decision needs to be made. Even things like do not resuscitate, those types of things are important for the families and the caregivers to know what you want. And then of course there is your will. How do you want the disposition of your assets? And it's not always what we think, what the eldest child might want.
Right. We often, and I'm going to go to you, Casey, because your mom had mentioned you're on her documentation, but we often hear people say that my daughter will take care of everything or my son knows what I want. Why isn't that enough? And what conversations should families be having long before there's a health crisis?
It's important to have those conversations. They are hard conversations for sure. It's awkward, it's uncomfortable. No one wants to have those conversations, but it really does make a big difference later on when we need to talk about a plan and when it is time to execute that plan. In our experience, that we have a lot of families where there's siblings involved or other family members that are involved, and they may not all be on the same page. So not having a plan in place can lead to a lot of sibling rivalries and arguments, guilt from a lot of the children of wondering, am I doing the right thing? Is this what my mom or dad would want? Just a lot of stress. You're already very stressed out when trying to make a transition or a care decision for your loved one, and kind of that guesswork of, well, what would they want? What is best for them? So it's important to talk about those things, as uncomfortable as it can be. It's so important, because what we think our loved ones might want might not be exactly what it is that they want. So it's important to talk about, for example, finances. What can we afford? How long can we afford it at this certain rate? Talk about the physical realities. If my mom falls, I don't work out, I probably can't lift her, or my dad if he falls, or what are her preferences? Maybe she doesn't want to stay home. She would maybe thrive in a community where she has activities and socialization. Maybe she does want to stay home and bring in caregivers. So just really talking about what it is that your loved one wants is so important.
Yeah, no, absolutely. And, Kim, we often hear people say the words long term care plan, and many think it simply just means I want to stay at home forever, which we all know that's not necessarily the case. But from your perspective, what does a real care plan actually look like?
So, excuse me, I got a little tongue tied. A care plan goes far beyond, what we do is help you figure out kind of the apartment or the appropriate community that makes sense for, for your residency and for your care, supported care living. But a care plan goes much beyond that. Like what do you want? Do you want mobility services brought into your home? Do you have a contractor that can come in and modify the bathrooms? It should be stages, and really think about, today I am able to take care of myself and perform all of my activities of daily living. Often you don't go from living at home to boom, you need to be in an assisted living community. There's gradual deterioration of your ability to be alone. And so, telling families, like, think through, maybe my mind is good, but my body can't get up and down the stairs anymore. What's the plan? Do you have a budget for installation of an elevator, or even space for it, or installation of a chair lift, that kind of thing? So a plan really needs to go beyond, beyond the budget. The budget is another critical element that we encounter a lot. People think, oh, well, Medicaid will pay for that, or Medicare will pay for that. And that couldn't be farther from reality. And it's a tragedy that we see a lot, where the family, has, that was their plan, to rely on the government, to take care of their loved ones. And that, number one, doesn't happen, and number two is really not thinking through a good progressive path for your loved one where they'll be well cared for.
Yeah, absolutely. And, Casey, some people avoid planning altogether because they worry they're somehow expecting or predicting the worst. How do you help families to understand that having a plan doesn't necessarily mean they'll need it? It simply just gives them more choices if, situations arise.
Sure. I like the analogy, it's a seatbelt analogy. We put on a seatbelt because, we don't want to get into a car crash. We put on the seatbelt so that we are protected in the event that we get into a car crash. And so planning and talking about these things is similar. It doesn't mean we are speaking this into existence and mom suddenly needs to go into a care home or a care setting. It just means we are going to be in control in the event that something like that is necessary. So we can make the decisions together. We can pick what kind of community we like. We can talk about, what our care needs are and the style. We can talk about the budget and what we're comfortable spending. If folks, unfortunately, they wait until they're in a crisis situation, then that control suddenly diminishes. You're now kind of doing what the hospital or what the rehab is telling you to do. They're looking for an open spot in a community, and you have to pick that first one that's available. So you do lose that control when you don't talk about things and make a plan. And that's hard for a lot of folks because we all want what's best for our loved one, but when we are in a crisis situation, unfortunately, a lot of families have to just go with the first thing that's available, and it might not be their first choice.
And that's a really good point, because a lot of times there are waiting lists. So you think people have all the money in the world, and they think, oh, I'll just go to the bougie place down the street when the time comes. And what they don't realize is there's 15 people ahead of you on that list. So, if you plan ahead, you can make, most of the time, a nominal deposit to be in line, so to speak. And then the community will call and say, Lance, the apartment you like that's eastern facing, is available. Are you ready to make the move? And you can say, no, I'm not quite ready. We're still doing well at home. Thank you. And they go to the next person on the list. So when your time comes, you're on the top of the list, or at least near the top of the list, so you're not kind of stuck going somewhere that you don't want to.
Absolutely. Well, and to piggyback off that, Kim, is, one of the most valuable things that families can do is to explore these options before they find themselves in that situation of needing help or trying to make the right decision under pressure. With our home care company, we've been in business 15 plus years, and we still tell families all the time, make the decision while you still can make it for yourself, not when somebody makes it for you. Meaning don't wait till there's a crisis and you don't have any options. Why is it important to tour communities, understand care levels, and think through all of these different possibilities before there is that emergency?
Availability is one reason we were just talking about, but I'll use my own mother as an example. We were helping my family navigate a move-in, a placement for my great aunt. She's in her 90s, and there's this beautiful brand new community, overlooks a marina. You feel like you've walked into the top end Marriott, and fortunately she's in a position she could choose whatever she could afford, whatever my mom chooses for her to kind of, she didn't plan. So we go in and we take the tour, and we're walking out, and I'm thinking, yes, this is going to be, a done deal. And my mom said, I would never live there, and I was thinking, wow, okay. So I would have thought she would have, because they have lots of other reasons why I thought my mom would like it, and then of course like it for her aunt. And I was completely wrong, and she selected a place that was far more traditional, even a little worn in, lovingly worn in, that she felt more comfortable visiting, and she felt more comfortable, with my aunt, with my great aunt moving in there. So, if you do take the time now, you can vet out all of those things. You can taste the food. I have a client I'm working with right now. He's in his mid 80s, successfully living at home. He's getting lonely, and so he's not quite ready. He's got some things he wants to do to his house, but we are going around now, and he's talking about maybe a first part of 2027 move. But we went last week. He's going back, I think he's going today actually, to their happy hour to see what the other residents are like, to see what the environment is like. So he can decide, is this really going to be a situation where I'm going to thrive and not a mistake? It's like,
That's smart. And it doesn't hurt ever to know what your options are. Casey, you both work with families who are often in a crisis after a hospitalization or even a sudden health event. Can you share how having an executable plan with the legal documents, family conversations, and care options already thought through changes that experience compared to families who are making those decisions under pressure?
Absolutely. It is a huge difference between the two, because often we do come across families who, like we mentioned, are getting discharged from the hospital or discharged from the rehab facility, and they have 48 hours. I mean, it is a quick, hey, insurance called and said you can no longer stay, your rehab stay is over. If you do stay past your covered days with your insurance, you're looking at $300 to $400+ per day, which is an extreme financial burden on families as well. So they call and say, hey, we need to find a place. We have 48 hours. They're stressed. They're frantic. There's arguing going on with family members, or they're missing work, or, online Googling everything and trying to figure out what to do next in a very short amount of time. So taking that away from a family and trying to help them navigate everything, whether it be a crisis or not, we are there to help guide them through. It is a much happier and smoother process when there is a plan already in place. So the power of attorney documents are already filled out. We know the finances. Daughter or son or trusted family member has access to those finances. They've already toured. They know where they want to go or what home care agency they want to have come into their home. It just makes the process so much smoother. It also, from a child perspective, the families can just focus on their loved one. They're going through a hard time. They're getting ready to make a really big transition. They need that support from their family. They don't need their daughter on the phone with a bunch of communities or getting very easily agitated because she's stressed trying to do what's best for mom or dad. They can feel calm and feel confident in their decision, and it just removes a lot of the frustrations and stress when there is a plan in place.
Yeah, great advice. You know, go ahead.
There's also a timing element, because if you don't have the permissions necessary to make, I have a client right now. The mom is no longer has the mental capacity to give the authority to anyone. Okay, so the son is very loving, doting son, wants to do the right thing. He has no idea how much money his mother has. So we have no baseline to even help find the right care solutions, whether it's care at home, a service like yours or a service like ours. Like we don't even have a financial baseline to start the conversation. And you can't just go up to the bank and say, "Hi, I'm Tina's son, Joe." They could laugh you right out the door, because of lots of reasons, the fraud and scam in the world these days. So, this client will end up having to go to the magistrate and get an emergency guardianship order, emergency custody order. It just creates this extra delay and headache and scary, legal court stuff that people don't need in this situation.
Yeah, absolutely. Well, Casey, Kim, where would you like people to go to learn more about you and the work you're doing?
So we can be accessed pretty much on all platforms. We each have websites, but if you go to carepatrol.com, it'll be able to help you find the closest location based on zip code. We also have Facebook pages and LinkedIn's and lots of different social media platforms. Or you can just pick up the phone and call us. We are not, just sitting behind a computer emailing families or sending out lists anywhere. We have cell phones, and families call and text us. We're here. We're local. We're boots on the ground. We're going in person to talk to these families, or we're going to their home and sitting on the couch with them and talking over options. We try our very hardest to do. This is stressful. Nothing about this process is easy, and so we try our very best to just take whatever load we can off the families. And it's nice to have a face, a person, somebody to talk to directly. Or, I get texts from families at 8 o'clock at night, and it's just nice to be able to talk to somebody when you're going through something like this, and having somebody there. I mean, I have clients holding their hand through the process. They really, really need that during a stressful time. So that's what we're here for. Local, boots on the ground, personal approach. We're in and out of all the communities, so we know what goes on. We know how it smells. We know how the care is. We know all of the little nuances. Are the residents being spoken to by their first name? Little things that we pick up on when we're in and out of the communities that really help us to make our recommendations to families, because they are not just a number or a person in a bed. They are somebody's mom or dad or aunt or uncle, and it's a very, very important decision. So we are here to help them through the entire process, start to finish.
Wonderful.
So carepatrol.com, we are, and nationwide. I know we're wrapping up our podcast here, but I think it's important to note that we are nationwide. We have boots on the ground in over 230 communities around the country and into Canada. So I have another client, they're in Pennsylvania, and they're relocating their loved one to be near one of the 3 daughters here in Virginia Beach. So we can help beyond. We are boots on the ground. We are very intimately familiar with our markets, but we have colleagues around the country, so we're able to help you wherever you are.
All right, wonderful.
And that's why CarePatrol is LTCareNav's preferred partner. We have met every single owner, and you guys are all wonderful, and it all come from such a great place. And we're so honored and privileged to have each and every one of you. And you guys are fantastic. So people listening, they really are as sincere and wonderful, and will be able to help your family.
Great. Lindsay, where would you like people to go to learn more about LTCareNav?
LTCareNav.com.
Wonderful. All right. Well, Casey, Kim, Lindsay, thank you guys so much for joining us. We'll have all the information in the show notes as well as up on the screen, and we just appreciate you guys taking the time to join us today.
Thank you so much for having us.
Our pleasure. Bye-bye.